Good afternoon, everybody. Coach Williams here from West Johnston with Dr. Leininger from UNC Orthopedics and Sports Medicine. Doctor, how are we doing today?
Doing great. Thanks for inviting me.
Awesome. We're here to talk about a really important topic for high school athletes, and that is concussions. Now, concussions are a topic that has become more important in recent years. The CDC estimates between 1.6 million and 3.8 million athletes suffer concussions, or to bring it more reasonably, about 10% of high school athletes are suffering concussions according to numbers. The purpose of this video today for parents is twofold. One, we want you to understand what a concussion is from the perspective of a doctor. And number two, we want you to understand what to expect if your child suffers a concussion or has concussion-like symptoms. Dr. Leininger, what exactly is a concussion?
Right, so the definition of concussion is a little bit soft. Basically, it's any sort of change in some non-specific symptoms that occurs after a head injury. So most commonly, the symptom that we get is headache. We also have issues with concentration, vision changes, dizziness, irritability, mood changes. There's a few other subtle symptoms as well, but that's kind of the gist of it. But the timing is real important. Like, did these symptoms start after the concussion? Now, it doesn't necessarily have to be immediately after the concussion, or after the head injury. It can be, a couple days after, up to, usually not longer than that, but I have had a concussion or two that the symptoms didn't start for more than 24 hours afterwards, but usually, say, within about 48 hours.
Now, if you're suspected of having a concussion, basically you report these symptoms in practice, the headaches and vision problems. What happens is that will be reported to your athletic trainer or first responder, and the first responder will then fill out some paperwork and will refer you to a doctor for diagnosis. Remember, the first responder cannot diagnose a concussion. We leave that to the professionals.
Right.
Dr. Leininger, if a concussion is suspected, we refer them to you. How do you guys test for concussion?
So yeah, we kind of have to put the whole picture together. We have to kind of see how bad the symptoms are. So we try to make sure that we get the kid put in an environment where they can feel safe and be honest with their responses. Sometimes parents can give pressure in one direction or the other. Sometimes they're given pressure to get kids back, and sometimes they're given pressure to be overly conservative too. So we have to kind of bear all that in mind, try to get honest answers from the kid. We also do neuropsychological computerized testing called impact testing. Do what you can to get your baseline impact test with your school here. We offer free baseline impact tests. From that information can help us, because if people's score in verbal or visual memory goes down a good bit, that can be a sign of concussion. We also do reaction time, something that's called visual motor speed. So those are part of the information that we use. So we take that information, we'll do some other physical exam tests to kind of test for balance issues, and putting all that information together, if there's some deficits, and you have some of those non-specific symptoms that came after a head injury and just not feeling right, typically that's at least a mild concussion. From there, if that's the case, then we'll follow typically about a frequency of once a week until the symptoms resolve. And it can vary. Sometimes these will go on for a few months, but most of these will get better within a couple weeks or so. When the symptoms resolve, we'll repeat the testing, make sure everything is objectively normal. When it is, there's a protocol developed by the High School Athletic Association, for slowly returning to play from a physical activity standpoint. There are times where we can do a little bit of earlier physical activity, if it's being prolonged for a little bit longer than a week or two. And so sometimes we don't start necessarily on step one there, because we can have already done that step as a part of the healing process. Sometimes a little bit of mild aerobic safe activity can be helpful. But basically, when you get through all those steps, you get all the way up to that kind of full contact practice at the end of it, which with one step per day of each of the steps. That's when we'll give clearance for full play at the next game.
And just to make sure that's understood for parents, that is part of the return to play protocol. And the return to play protocol will be administered by the licensed athletic trainer at your school or the first responder, just to make sure that your child progresses through the stages without a return of symptoms.
Correct.
So that's basically just to make sure that everything goes safely. This entire process is about erring on the side of caution for your student, for your child, because frankly, once that sport ends, they're still going to need their brain for the rest of their life. So we want to make sure it is in as great a shape and comes back just as good as it was when they showed up on the field to play that day. Well, folks, please make sure that you check out any resources on our athletic webpage for information about concussions. All of the forms and paperwork you need are on there. UNC Orthopedics and Sports Medicine does a great job as one of our partners, so please consider going to them in the event that something is necessary. They have great doctors, Dr. Aliotto, Dr. Leininger, who are trained to handle sports-specific injuries and can put the best plan together for your child. Dr. Leininger, we appreciate your time today.
Yeah, man, thanks.
Thank you.